afternoon. Thanks for stopping by. My name is Yvonne Chalfont. It's my privilege to serve as the Foundation President and Executive Director here at St. Mary's Hospital. As you know, the servants of the Holy Heart of Mary brought emergency hospital to the greater Kankakee area 114 years ago. And it's important that you know St. Mary's is still here doing exactly what the sisters taught us. Our staff and our physicians provide healing and hope to our community on a daily basis. And the gifts you offer through our foundation enable them to continue to serve you, your family, and your friends. I'd like now to take you on a quick tour of the hospital so that you can see your gifts in action. Wait just a moment, I'm going to go get my coat because our first stop is at the Cancer Center on Route 45. I'll be right back.
I'm Dick McLean.
Dick was receiving chemotherapy. We noticed a great need for the staff to have 2 datascopes versus 1. They use it in the front office and they use it in the back office with the patients who are receiving chemo, and it seemed to be a great hassle for them. So we decided if we donated money for another datascope, it would help all the staff.
I'm Barb Hartman. I'm the patient care manager here at Provena St. Mary's Cancer Center. And the McLeans were very gracious in donating this piece of equipment for us. It is a datascope, and what it allows us to do is to take frequent vital signs on patients who are undergoing their chemotherapy, to monitor them for any kind of reaction or change in vitals while they're getting that. It allows us to take their temperature. We can also do a pulse ox, which checks their oxygen saturation. And we used to have just one that we used throughout the whole department, and this has allowed us to designate one to our front staff and one to our back staff, and to serve our patients better by having the equipment readily available.
That was a quick trip, and we dodged raindrops all the way. Are you ready now for another trip upstairs? Let's take the east elevators to 4th floor, go to pediatrics, talk with Linda Jones and some of her friends, and see what's happening upstairs. Your gifts have made a difference.
Okay, my name is Linda Jones. I'm Director of the Women and Children's Services here at Provena St. Mary's Hospital, and I'm going to talk a little bit today about the wonderful equipment that we've been able to purchase due to the gracious donations that all of you have made for Provena St. Mary's Hospital. First of all, I'd like to show you the crib. This is called a cub crib. We were able to purchase 2 of these last summer, and they give us a latest updated model for our children. A couple of our favorite features as nurses are the fact that we have easy access to our patients. If we have a child who's sleeping and we need to check an IV or a temperature or something, we can quietly put the bed rail down and gain access to our child. Or if your child has an IV in his foot, you can gain access this way. Notice how nice and quiet, something that we're not used to. So it's great to keep children sleeping while we're checking on them. There's actually 4 ports in this crib that allow us to gain access this way to our child, 2 on the other side. And a really nice feature is the scale. There's a built-in digital scale here, so upon admission we weigh our child, and without taking IVs and other equipment with us, we can simply push some buttons and weigh our child every day. Another really nice feature of this crib is it moves around easily, so with a flip of the brake, the beds move quietly and nicely. Also a great update for us, and of course the safety features. The slats and all of the equipment have the latest safety features, which helps the nurses feel good about knowing their children are going to be safe when they're not in the room, and the parents as well. So we're very thrilled to have 2 of these cribs. The staff love them. We learned about them when we were very busy and had to rent cribs. These were the models that we rented, and they loved them so much that we eventually were able to purchase 2 new ones. So thank you very much. We're very thrilled about them. We were also able to purchase, with the gracious donations, 5 sleep chairs for the pediatric unit. We had had many complaints from our older model chairs, so what we did this past summer, when we knew that the funds were going to be available, we had the parents vote. They were able to if they were here for 2 nights or more, they were able to sleep in 2 different styles, and then for 3 months during the summer, the parents voted the most comfortable chair. So we were able to then purchase the winner of the vote, which was this model. It's an easy pull-out. I'm not going to pull the whole thing out, but it's an easy pull-out type version. We bring in bedding and pillows for the family member that's spending the night, and then in the morning we just take it away and they get fresh linens the next night, and they actually, reclined. So these actually recline as well. The pillows go back. Once you pull it out, it goes to a flat, completely flat surface. We chose this fabric. It looks like water, so we chose it to go with the fish that are on the wall. And then we were able to purchase 15 side chairs. Because it's an older unit, we had some older model chairs, heavy to move around, weren't real conducive to the rooms, so we were able to purchase 15 side chairs to match the sleep chairs. They're lightweight, they are easily moved around. They have a special backing to keep them from making marks in the wall. That's very important. And so we're just thrilled to have these. Our parents are raving about the comfortableness of the chairs. As you know, if you've spent the night in the hospital with a sick child, comfort is a big thing. So we thank you very much. Not only can visitors have a nice place to sit, but the parents can spend the night right next to their child and watch everything that goes on and be there to comfort their child. So again, thank you very much for your very generous donations.
Carol Brayford. I'm an employee of Provena St. Mary's Hospital. I'm a manager of ultrasound, nuclear medicine, and CT. But today I'm here because of the Special Appropriations Committee of the Bourbon Friendship Festival.
And I'm Heather Morgan, and I am the Special Events Director for the Bourbon Friendship Festival.
And I'm Linda Jones, Director of Women and Children's Services here at Provena St. Mary's Hospital.
And we're here to talk about a gift that was made on behalf of the Bourbon Friendship Festival through the Special Appropriations Committee to St. Mary's Pediatric Department. And Heather's going to tell you all about that.
Bourbon Friendship Festival a few years back had a baby contest where babies would come in, their parents would bring them, they'd be judged on smile, beauty, dress, everything like that, and it was just a total mess. These babies were crabby, it was hot, it was raining. So 2 years when I joined, 2 years ago, I decided to introduce the baby photo contest. So instead of bringing your child to the grounds, just submit their photo and they'd be judged that way. We decided it would cost 10 cents a vote, and you can just place your dime in the bag that you like with the picture, the cutest picture, or whatever you liked. And at the end of the event, baby with the most money won the entire contest. There were different ones in each category, and then there was an overall baby. And I decided that I wanted to donate this money to something dealing with children, since it was a baby photo contest. And when it was brought to my attention that Provena St. Mary's Pediatric Unit needed some new technology, I just thought that was a really great idea. And I love children, and just tugged at me that this money needed to go here this year.
And also, one of her most favorite people in the whole wide world was her Uncle Lee. And on his behalf, money that was donated at his visitation for his memorial, he so loved children and so loved St. Mary's that was donated to the pediatric department also.
Another donor that has been able to join into this project is Mancino's in Bradley and Bourbonnais, and so we're very grateful for that as well. We've taken in all of these funds, and because the pediatric department here at St. Mary's Hospital is in need of newer technology, we have chosen to provide each of the patient rooms with a new flat screen TV, one step larger than this model. We are working with local vendors in town to apply for matching funds and see if we can purchase 11 flat screen TVs as well as 11 DVD players. Because our children are coming in with DVDs and we still have VHS players, and we have older model, large with the big back, mounted to the high part of the room, Sylvania TVs, and unfortunately they can't talk to the newer DVDs or even the games that the children bring in. So, because we had such generous donation, we moved over to pediatrics in February here on 4 East. We decided we'd go ahead and update the rooms with the other donations that you've seen tonight with the new technology of flat screens and DVDs. So we hope very soon to be able to get those mounted, and brackets were included in that purchase, so we're very, very grateful, and I know that the children and their parents who will no longer be bored while they're sitting here for days on end are very grateful. So thank you very much for your generous donations.
Are you keeping up? We're here now at the EMS office where we're going to find Gordon Campbell, head of our EMS training, and Tony Brunello of our cardiology and stroke service lines. Let's go in and find out about the gift they were able to purchase from the 2010 gala. Let's go in and see if they're here.
Hello, my name is Gordon Campbell. I'm the EMS educator and coordinator for pre-hospital education.
My name is Tony Brunello. I'm the clinical leader of the cardiology service line and stroke coordinator here at Provena St. Hospital.
We'd like to take a minute to thank you for supporting us with the monies we used and received from the gala event. Help purchase this mannequin that we're going to show you, which will greatly improve the quality of education we can provide so that they can serve you better. So, Tony, would you like to show them what we have?
Sure. What we have been able to purchase is basically referred to as a sim man. This sim man is able to simulate almost all bodily functions. This mannequin actually breathes on its own. As you can see, right now it's just breathing a little bit here. We actually can have bowel sounds. If we look up here to even the eyeballs, as you can see, and these can be exchanged, we can take a look there. This mannequin has the ability to where we can intubate it for pre-hospital providers, or we could intubate it and actually place it on a ventilator for our critical care nurses so that they will have more experience in a situation with a patient such as this. Patient is able to be defibrillated. We're able to actually get a blood pressure, check pulses, and know that we've actually checked pulses.
Physically?
Yes.
Yes, you feel them. And behind us we have the monitor. This simulates the bedside monitor, such as you would have in a monitor in an ambulance, or the monitor you would have in the intensive care unit or telemetry unit. The laptop is where we control what happens on the monitor. We can change the patient by what the treatments they do. The algorithm can run its course, so if you don't treat it as well as you could be, the patient will get worse, which Tony then will tell them how to read those diagnostics, listen to the person, because this mannequin not only has the feel of the pulse, the lung sounds, it will and can talk to you also. Tony, why don't you check and see in a second if we have any allergies?
That sounds good. Sir, are you allergic to anything?
No, I'm not allergic to anything.
Are you having any chest discomfort at this time?
No.
Are you having any difficulty breathing?
Yes.
So by doing that, we're going to be able to actually have that interaction. We have actual lung sounds that the nurses and the medics will actually be able to assess. This will be real-time, hands-on training that will enhance their critical thinking and clinical reasoning abilities, which is the most important aspect of all when you're providing medical care to someone.
Which brings us to the final point of our nice equipment that you helped purchase. Here we have a webcam that videos and records everything we're doing to this person so that when we debrief them, we actually see the video of what they did while it records their actions. So the teaching is complete. You have real time and a chance to go back and critique.
Okay.
We're here in the surgery department. We're going to be looking up Debbie Case and Gina Shell-Lamore. They have some new surgical cards to tell you about. Let's go find them.
Good evening, everyone. This is Debbie Case. I'm the Patient Care Manager of Outpatient Surgery, Recovery Room, and Special Procedures. And this is
Gina Shell-Lamore, and I'm the Perioperative Services Business Manager.
And we're here in the operating room holding area to show you the new eye stretchers that were purchased through the Frederick C. Hamilton Eye Foundation. monies, which we are so appreciative of. This bed is used for eye procedures that physicians are going to do, like cataract extractions or any type of procedure involving the eye. And it is unique in its structure of the head of the bed. You see where it's cut out on the sides, and this is where the patient's head lays, and it's concave so that the head fits in it, and it is movable to move it to position the head as the surgeon would see fit. It's like, as you see, Gina's legs fit right underneath it so that the surgeon can get right where he needs to be. As you would imagine, it's very meticulous, precise surgery that needs to be done in the eye, so it's real important for the surgeon to get right up into the field that he's going to need, he or she's going to need to work on. One of the other advantages of the new bed is they're the softer, more comfortable mattress for our patients. They're a little wider to accommodate the patients more comfortably, and it just really is a unique setup for eye procedures. Oh, and we have, how many did we purchase through this monies? We purchased 5. So we have 5 new eye stretchers for our surgeons to use.
We just arrived on 3 West. Let's take a walk down the hall to our telemetry unit and look for Becky Leonhardt, who wants to tell you about a gift she's received.
Hi, my name is Becky Leonhardt. I'm the patient care manager at 3 West Telemetry at Provena St. Hospital. I'm inviting you into 3 West Telemetry. This is one of our patients' room, and to show you our new purchase that we received from the Sherwood Noble grant from 2010. We are very grateful, as well as our patients are. There's many wonderful features about this chair. It's nice and wide for patient comfort. There's a high back to it. There's also a footstool for our shorter patients to be able to step up to the chair if need be. There's also, it's a reclining chair, so we can recline the patient, and also the tray for them to be able to set anything that they need close to them, their meals and so forth. So we're very grateful here, as well as the patients are very grateful. It's been a wonderful chair for all of our patients. I've heard many compliments about the chair and the comfort of it. So thank you very much.
Our last stop will be administration. We're going in here to find Amy LaFine. Amy received a wonderful gift this year from the servant leader donors. Let's go inside so she can tell you about it.
Good evening, friends. I'm Amy LaFine. It's my privilege to serve Provena St. Mary's as the Vice President of Clinical Operations and Chief Nurse. I wanted to personally thank you for your 2010 contributions specifically targeted for nursing education. Our schools of nursing prepare our clinicians for licensure. We then take over and continuously develop our clinicians for expert practice. Instruction ends in the classroom. Education should only end with life when we are committed to excellence.
I hope you've enjoyed our quick trip through the hospital today and you've been able to see your gifts in actions. On behalf of all of us here at St. Mary's Hospital, thank you for the gifts you've made to the foundation in 2010. Remember, every gift given to St. Mary's makes a difference. Thank you again.